we want to talk about our military members. September is Suicide Prevention Month. Right now, there is a suicide crisis among military women. So we want to talk about this new campaign that's being launched right here in San Diego, helping highlight this important, urgent issue. We're joined here this morning with Shanae Ball, the Regional Director of the Stephen A. Cohen Military Family Clinics. Shanae, thank you for being with us today. It's great to see you.
Me.
Of course, you're a proud Navy veteran, serving honorably as a hospital corpsman, also a spouse of a retired U.S. Marine Corps officer, and a licensed therapist. So this topic, I would imagine, near and dear to your heart.
Absolutely. The Have Her 6 campaign, which we are partnering with, we are part of the Stephen A. Cohen Military Family Clinic right here in San Diego. We want those women veterans to be able to have a voice and seek the care that they need. We have seen, well, actually the military women and military women veterans have a 92% increased rate of suicide in comparison to their civilian counterparts.
92% higher. Tell us why that is, and what we can do about it. 2 million right now military veterans, women veterans, and so many are at risk, unfortunately, of going through this, struggling. What are some of their struggles?
Well, military life is a very challenging life. They are doing dangerous work, they're participating in combat, and a lot of women just feel silenced and unheard in a male-dominant world. But we at the Stephen A. Cohen Clinics, we want to provide a way for those women to get the care that they need. We want to increase their access to care, and there are a lot of barriers to care. A lot of women have families, so the child care is a factor. What will I do if I need to spend an hour with a clinician or a behavioral health provider? But at our clinic, we try to reduce as many barriers as possible. We provide on-site child care for families at our clinic.
Yeah, I would imagine women in any industry are going through this crisis in the form of work and taking care of kids, and the burden kind of falls on a lot of women. So for military members, especially, to have the time to take care of themselves and their wellness, their mental health, this Have Her 6, Prevent Military Women's Suicide. That's the new program at the Cohen Clinics. Tell us what that means, Have Her 6.
Absolutely. So Have Her 6, it's a phrase that's used by military and law enforcement across the world, I'm sure.
Yeah.
But what it means in this particular campaign is we see you, we hear you, we have your back, and we want to show up for you. For these women that are struggling, we want them to know that we are readily available to provide counseling for any challenges that they are facing, for any emotional dysregulation. Come and see us at our clinic and we'll get you taken care of with a qualified military specialized behavioral health provider.
Okay, and for so many members of the military and veterans especially, tell us what that's like. You've served so many years, and then you're a civilian now, and after having so much, obviously specialized training, I can imagine the unknown of what to do next is also a daunting thing to have to figure out.
Yeah, well, actually just getting out of the military, that transition piece, like it's a career shift.
Right.
So with any big life transition, there could be feelings of depression, anxiety. What am I gonna do next with my life? So those factors, the military actually does a really good job at providing transition resources today, but we still process things a lot differently, right? And moving on to something new, feeling like you're not a part of that team anymore, because for a lot of people, they join right after high school. That's what they know, that's what they do. And that transition can be huge. Feelings of depression and anxiety can occur. And it's a great opportunity to seek the help that you need and resources. Our clinics provide case management resources for jobs, also for financial resources. All of those things, that period of uncertainty could lead to thoughts of, I don't know what to do.
Right.
I don't know what's happening.
And the depression that goes with that, we want to mention suicide is preventable. So Shanae, I'd love to talk to you about some strategies that we should all be aware of to support people who are going through really tough times.
Yes, absolutely. So recognizing those signs, if someone is depressed, if someone is talking about suicide, if someone is talking about death and dying, increased substance use, not sleeping well or sleeping too much, show up for them. There is often stigma, well, if I talk about suicide, then the person may commit suicide. That is actually not true. We should talk about those things and show up for people. We want to bring them into our clinics.
Real quick, we only have a few seconds. What's a good resource? Who can we reach out to?
CohenVeteransNetwork.org and 988, then press 1. You can text or call that, that number.
Okay. Thank you very much, Shanae, for being with us today.
Thank you for having
Such an
me.
important topic. We'll be right back after a quick break.